So for today's video, I will be demonstrating the different physical assessment such as the skin, hair, and nails, the head and neck. So first, we have to gather the equipment that will be needed in this assessment, and for me, I already completed it beforehand. So now I will first assess the skin, hair, and nails of the patient, and the equipment that will be needed are the pen light, the exam gown, and the gloves. So now I will introduce myself to the patient. So hi sir, my name is Sophia Lorraine and I am your student nurse for today. May I know your name please?
Allen.
So your birth date, Sir Allen?
February 17, 2010.
Okay, so thank you Sir Allen. So for today's po, we were going to assess your skin, hair, and nails, which is important to determine if there are abnormalities. And if there are po, we're going to refer this to the other healthcare provider. Okay? So after this assessment po, bibigay po natin sa kanila. At para malalim pa yung examination about your health condition. Is that okay po? So wala naman pong ibang questions. So pwede naman po magtanong later on habang nag-assess tayo. So after I introduce myself to the patient and verify the client identity and explain the procedure, we will now proceed to the putting the exam gown to. Sir, can you put this gown po for the safety? Going to put this up to expose the skin. So after I put the exam gown to the patient, I will now inspect the skin for skin coloration and skin integrity. So sir, can you flex your arms po for a while? Okay, so the Sir Allen skin is normal as it not show the sign of jaundice or the yellow color of the skin or bluish or lack of oxygen. And the skin is intact, okay, which is normal. So now we will now proceed to inspect the skin for lesions. Can I borrow? So, there are no lesions naman, which is good. So, next, we're going to palpate the skin and we will need a gloves when palpating the skin of the client to avoid contamination. So, we're going to palpate to assess the texture, thickness, and the moisture of the skin. So, as I palpate the skin of the patient, the skin is smooth and even, and the thickness is thin, which is normal. And for the moisture, it is not dry, which is good. And also no lesions and those lesion naman ay mga common findings like moles and stretch marks. We need to assess the skin temperature of the skin, which is done by placing the hand to the face of the patient. And sir, so temperature naman ni sir ay normal, which is warm, and that's good. We'll now also palpate for mobility and turgor of the skin patient, so which is done by supine position of the patient to check for the turgor. So sir, can you lay down your okay? So when we check for the turgor of the patient, we will need to pinch the skin and check for mobility. Of course, we will like this. So the skin mobility and turgor of the patient is normal. As it, when I press it, when I pinch it up, it returns back immediately, and also it elasticity. So the last thing we need to assess for the skin of the patient is palpate for edema, which is done in palpating the ankle. This one, this. Okay. So as I palpate naman the feet of the patient, there is no edema presence naman. So after I assess the skin of the patient, we will now proceed to assess the scalp and hair, which we will inspect for the hair condition, the amount, and the distribution. So I'm going to the other side to see. Okay. So after I inspect the hair and scalp of the patient, there are no abnormalities naman, and any presence of alopecia, which is the loss of hair, and the amount and distribution is also normal, and the hair condition is. So now, we will now proceed to assessing the nails, which is the last organ in integumentary system. So can I answer your hand for the nails inspection? Okay. So as I inspect the nails of the patient, it is clean and manicure, and also the color is pink tone, which is normal, and also the shape is also normal. We will now proceed to palpate the nails of the patient. So we have to do this. As I palpate the nails of the patient, the nails are hard and immobile, and need to test the capillary refills, which is with it done by pressing the tip of the nail like this, and normally it returns agad-agad. And as I press it naman yung sa nails ni sir, nag-return naman siya sa pink tone, which is normal. Okay, sir. Thank you, sir. So, after we assess the skin, hair, and nails of the patient, we will need to document all the findings that we find throughout the assessment. And now, sir, we're done in assessing your skin, hair, nails, and all goods po naman, which is in all normal and no abnormalities, and we will have to finish this po. And thank you po, sir, for participating and cooperation. We will now assess the head and neck, which is we will need the pen light, the gloves, and also the bell of the stethoscope. So now I will be introducing myself to the patient. So hi sir, my name is Mia Lorraine, and I am your student nurse for today. May I know your name po, please?
Alan.
So Sir Alan, your birth date po, please?
February 17, 2003.
Okay, so thank you, Sir Alan. So for today po, we were going to assess your head and neck, which is important to determine if there are abnormalities or any present concern that need a healthcare attention. Is that okay with you po? Do you have any questions po?
Nothing.
So you can ask naman po later and while we're doing the assessment. Okay po? So after I introduce myself to the patient and verify the client identity and explain the procedure, we will now going to proceed to the assessment. And before that, I will be providing the privacy to my patient. So assuming that I close the curtains and doors, and assuming then that I perform the hand hygiene with alcohol for 20 seconds. So now we will now inspect the head for the size, shape, and configuration. So sir, so the shape incision size and configuration is normal. You will need a gloves. We will now proceed to palpate the head for consistency. Okay, so there are no any lesions and lumps and masses naman in the head of Sir Allen. So next we will now inspect for the face of the patient, if it is symmetrical, the shape, and also the skin color. Okay. So the face of Sir Allen is symmetrical, which is normal, and the skin condition does not show any jaundice, the yellow skin, and bluish or redness of the face of Sir Allen. For the expression naman po, sir, can you smile for me po? Okay. For the movement, okay. So all good naman po for the movement, expression, and skin condition and all. After I inspect the face, we will now palpate the face for the temporal artery of the patient. So the temporal artery of Sir Allen is non-tender and elasticity. So now we will now proceed to palpate the temporomandibular, which is going to by opening the mouth of the patient. So I will place my hand to the temporomandibular, and sir, can you open your mouth po? Okay. So the range of motion of temporomandibular joint of Sir Allen is normal, and there is no swelling naman. And sir, do you any feel pain po when you open your mouth? Also, there is no pain naman daw po. We will now proceed to the assessing the neck, which is we want to inspect for the position of the neck. So we will need a pen light for this one. So okay, as I inspect the neck of the Sir Allen, it is positioned centered and it is symmetrical. So we will now move on to the inspection of the thyroid and cricoid gland movement by this glass of water. And sir, I want you to sip a small cup of water. So, wait lang po. 1, 2, 3. Okay, so as I inspect the thyroid and cricoid gland of the patient, it is non-visible but palpable while swallowing. So we will now inspect the cervical vertebrae of the patient. So sir, can you so I will go to the posterior back, to the posterior of the patient, and sir, can you look down for me po? Flex your knee, flex your neck. So as I inspect the cervical vertebrae of the patient, it is visible, which is normal. Next is we have to inspect the neck range of motion. So sir, I want you to look for the right, look to the right, and look to the left. And after that, you have to touch your each ear to the shoulder like this one. Okay, and I want you to look up and down. So, okay sir, thank you po. So after I inspect the range of motion of sir, he has controlled the motion, which is normal and good. Now move on to palpate the trachea of the patient. So I will use my finger to look this. As I palpate the trachea of the patient, it is midline, which is normal. And now we will now proceed to palpate the thyroid gland. So, sir, can you... Okay. So, as I palpated the thyroid gland of the patient. There are no masses palpated on it, which is good. So we will now move on to auscultate the thyroid gland of the patient, and for this we will need a stethoscope. It is in the bell side of the stethoscope. So, sir, I want you to hold your breath for me for a second while I auscultate your thyroid gland. Okay. So as I auscultated the thyroid gland of the patient, it is normal naman, which is without masses. So the last one we will need to palpate is the lymph nodes, which is in the head and neck of the patient. So first, sir, I want you to move right to me, and then the first thing we have to palpate is the lymph nodes in the front of ears, which is called preauricular. And we will go to behind the ears, which is called the postauricular. And then we will move down to the occipital lobes, which is here. Okay. And then we will move to the tonsillar, to the submandibular. And when we palpate the submental, we will only using one hand. Okay. And now we will go to the superficial cervical, which is here. And posterior cervical, this one. And we will go to the deep cervical chain, which is here. And the last lymph nodes we will going to palpate is the supraclavicular, which is we will going to use a fingers only. And sir, I want you to elevate your shoulder like this one po. And we will going to hook it like this one. So as I palpated the lymph nodes of Sir Allen, it is non-palpable and it is non-tender. So sir, we're done assessing your head and neck, and I'm going to document all the findings we obtained while assessing this, and this is the end of the assessing the head and neck of the patient. And thank you for participation and cooperation.
Thank you.